welcome to this session of York County Government. My name is Greg Moore, and I serve as Chair of the Eau Claire County Board of Supervisors and also the moderator for today's program. With us today, we're talking about intergovernmental and other collaboration that takes place in Eau Claire County. And with me today, we have Colleen Bates. Colleen is first Vice Chair of the County Board and also is Chair of the Joint Commission for Shared Services with the City of Eau Claire and the Eau Claire Area School District. Lieska Geise is Director of the City County Health Department, and Frank Draxler, Purchasing Director for both Eau Claire County and the City of Eau Claire. So welcome to all of you. Thank you for joining me today. Why don't we start with you, Colleen? You're, as I noted, you're Chair of the Joint Commission for Shared Services. Why don't you talk a little bit about that, as well as other work that the county does with collaboration?
I'd be glad to do that. The Shared Services Committee has been in existence for a number of years. In fact, Frank's position actually evolved from the effort of that committee by looking at ways that we could either share personnel or program. His ability to work across two government entities with purchasing and with other management type skills has certainly been a boon to both the city and the county. We also have a shared space for the sheriff and the police department in the new courthouse, which makes collaboration between those two entities really well.
And maybe if I can just interject on that, right, so it's a joint law enforcement center.
Right.
One desk for public contact, shared lockers, shared evidence storage, shared briefing rooms, and so on and so forth.
Right, and actually they both have a similar mission, so it really makes sense. Mm-hmm. And sometimes they depend on each other to be able to take care of an issue that may come in the community. If I look at the kinds of collaborations that the Shared Services Committee has been involved in, we're really also looking at not only what we're accomplishing now, but where is there a vision for what we're going to look like in the future. So this is a vehicle that allows those kinds of thoughts and that kind of collaborative thinking to really try to figure out how do we provide better services at less cost with collaboration. Those kinds of collaborations could exist in other areas as well. And I'd like to talk a little bit about our ability to be able to collaborate in the community through the University of Wisconsin Extension. Our Extension folks are actually faculties, members of the University of Wisconsin. And they're in the community in so many different capacities. That allows us really to leverage community nonprofits, community clubs, agencies to be much more effective in their planning and also in our agricultural industry. We have a lot of right on front line research that can be used in so many areas, everything from agriculture to parenting to child rearing to even now our issue with heroin. Mm-hmm, mm-hmm. So it really, for every dollar that we spend as a taxing dollar for the University of Wisconsin, we leverage about $7 or $8 in the community. So it's a good investment for us. We continue to try to work towards having more and more collaborations. That leverages additional personnel, additional funding, access to grants, and obviously a much closer relationship between agencies that have similar missions. Mm-hmm.
Well, thanks. And you had mentioned vision a moment ago, and Lieska, in terms of the City County Health Department, our predecessors had a vision of combining city health and county health, and as I recall the history, Eau Claire County was one of the first in the state to have a combined health department. So, why don't you tell us a little bit about that history, but then what the City County Health Department is doing these days and using collaboration to be as effective as possible.
Absolutely. So pre-1950s, there was a City of Eau Claire Health Department and a County Health Department, and there was good thought that went into merging those and creating a single health department that was both a city and a county health department. Uniquely, Eau Claire City County Health Department and the Madison and Dane County Health Department merger are really the only two that have that model in the state. Strength with that is that we really not only focus on the county as a whole, but have a particular focus on the city of Eau Claire as well, and very close relationships with Eau Claire partners. unique and some strength because of that. We also are really fortunate as a health department to have a core mission of focusing on partnerships. So I think the theme for today really is absolutely what we do every day, those partnerships across government, which are critically important, but also our partnerships outside of government. A couple of quick examples I can give you, but we certainly can talk more about that. We work with the state health department very closely as one of our core partners. The state has really looked at Eau Claire, being a larger health department on this side of the state, as being a leader. So we provide, for example, with state funding, support to other local health departments, other county health departments outside of our area around HIV services, as an example, or women's cancer screening. So again, we partner with those local health departments to provide strong services in the region that really support health across our borders. And that's important because people come to Eau Claire that are not just Eau Claire residents. With state funding, with federal funding, we can be that kind of a regional strength. We also work really closely with all kinds of entities within Eau Claire County to support health. I think we all know that none of our health issues are simple. We can't solve them easily. A couple of examples of that: there's a very strong methamphetamine task force that is in Eau Claire, made up of governmental entities that are working together in Eau Claire County to say, what's going on here, look at the data, and how can we approach this differently? And that includes the judicial system approaching it differently, the law enforcement system approaching it differently, and public health looking at prevention, so across that whole spectrum. And another example of collaboration and some really strong work coming out of that group.
Lieska, could you talk a little bit about the effort in mental health?
Yeah, that was going to be my other example, Colleen, so thanks. So mental health is an issue that we really know is not just an Eau Claire issue, but certainly something that is a concern across the state and nation. There is right now a really strong effort to pay attention to how can we explore mental health differently. We've been putting a lot of money and resources, important money and resources, to trying to help people way down the stream we talk about in public health rather than upstream, trying to support health before people have struggles. And the hospital systems, Marshfield Clinic, United Way, many of our other community partners, and within county governments, so the human service folks, county extension, and many others are really pulling together now to try and look at that continuum. So how can we still make sure we have very strong support when people are in crisis? We can't stop doing that. How can we support people that unfortunately end up in the law enforcement system and make sure that we, if there are mental health issues, move them to the appropriate place of care as quickly as possible? But then also, how can we go way upstream, the public health world, to say, we need to stop this faucet from running full blow. We need to stop it early on. How can we support kids and families to really prevent some of those mental health crises down the road? So those are a couple of examples of collaboration, both intergovernmental and with community partners.
Maybe one other one, if you'd speak to health data and how that is, a collaborative effort on healthy counties and the network where the public, as well as research institutions or other entities, can go get the data. Can you just talk briefly about that?
We've been really fortunate in Eau Claire that a variety of partners, including the hospital systems, Marshfield Clinic and United Way, as well as the health department, have for the last few years now worked together to pool dollars, resources, collaboratively, and purchase an online web portal with health data. That's at EC Healthy Communities. Very easy to find, echealthycommunities.org. That site has local health data, and it compares that data at a state and national level as well, to really give people an opportunity to say what is going on in our community and how can we use that data to inform choices that we make about services and interventions moving forward. We've been fortunate. We've applied at the health department with a team of people, again across agencies, for a grant from the Medical College of Wisconsin. That those grant funds came in to really help us understand how we can get people to that site. So it's not
Okay.
just sitting there,
Right,
but
right,
we get
right.
policymakers like the two of
Yeah,
you
yeah.
there, people like me that need that data to write grants and to support best practice, and our community partners there. So we've been very fortunate to make that a robust site, and it's a national vendor, and they've really seen Eau Claire as an example of how to improve use of health data.
Great. Well, you mentioned about purchasing a website. That might be a good segue to our purchasing director. So Frank, why don't you tell us what a purchasing director, what you do and oversee, and how it's worked out with having you serving both Eau Claire County and the City of Eau Claire.
Sure. We've looked at many things over the years with the Shared Services Commission, and purchasing was one. And in 2003, we began a trial, a program of sharing purchasing staff and looking at even a full merger. So at this point, it includes my role as director for both the city and the county purchasing, and supervising staff at both the city and the county in the purchasing department. It brings us together so we can work together in many areas, but specifically in purchasing, our purchasing staff can be experts in different areas, so we can help purchase commodities, let's say vehicles for both the city and county. And we can combine our spending power to get better deals for both the city and county. So not only does the city and county save money on staff, myself, there's one less manager, but we save money every year by buying together and getting better prices on what we spend our money on.
Great.
And I guess one thing to add to the Shared Services Committee. So not only to city and county, but as you know, Colleen, you work with the school board, and we've worked with the school in many different projects, and currently in the last few years we've been working with them on health insurance, and that's an initiative that it will continue to work with the city and county and the school district to work with health insurance for employees and our retirees, to perhaps to become self-insured, perhaps to direct contract with less cost, but to save money, because totally we spend over $40 million a year on health insurance, and so we're looking at that as a combined spending to save some money.
Great. And I know you have different responsibilities, but other folks aren't here today, but I know Eau Claire County collaborates with the towns on a variety of highway issues and land use. Our planning and development people work closely with them.
Talk a little bit about broadband.
And broadband? Well, we only have about a minute. So why don't you speak very briefly about broadband, and then I'll just give a final opportunity for folks to make
We were
remarks.
the recipient in Eau Claire County of a significant broadband grant, and it really benefited the whole region. And it also made for just terrific collaboration between hospitals, schools, tech college, university, and really, again, it's an economic tool and a learning tool. And certainly, I think it's an absolutely great program.
Great, thanks. Final thoughts?
Yeah, I can't imagine doing the work we do without partnerships. It makes it more efficient and more effective. We certainly can bring more dollars in if we're working in partnership, and really get to the core of what needs to happen to change health. We know we've got some messy health issues, and we'll continue to have those, but working together, I think we can make an enormous difference. And not flounder because we don't have enough resources, we don't have enough people. Working together, you can pool that and make a difference.
Great.
I agree. I think working together on partnerships, on cooperation, on different projects leads to better services for the public. And if we can save money at the same time, it'd be best for everybody.
Great, great. Well, thank you all. Thanks for being here once again. Colleen Bates, Lieska Geise, Frank Draxler, and thank you for joining us today, talking about Eau Claire County and how the county uses intergovernmental and other collaborations to provide services to the public. Thank you.
The mission of the Eau Claire County Board is to provide quality and responsive services and programs aimed at protecting the public safety, health, and economic security of our residents in a cost-effective manner through innovation and leadership. Your county government is produced through the facilities of Chippewa Valley Community Television in cooperation with the Eau Claire County Board of Supervisors. For more information about the Eau Claire County Board and how they aim to help the residents of Eau Claire County, go to www.co.eau-claire.wi.us.